Welcome to SmileFy Webinar. For us, it's a pleasure to have you here in one of our special events. We have over 100 doctors who registered for this session, which means that creating multiple 3D workshops is a very hot topic that we have now in dentistry. I'm Dr. Diogo Alves, and I'm the Director of Clinical Education here at SmileFy. And today I also have here George. George is also a dentist, and he's an integration consultant at SmileFy. If you have any questions, please just let him know in the chat. How are you doing, George?
Hi, good morning, everybody. I will be taking care of some questions that doctors have, so I will be just paying attention. I'll help you, Diogo. Thank you.
Wonderful. Well, so if you are here today, it's because you also want to become a smile designer. You also want to enhance the way you do your consultations with your patients. And this is definitely what we are going to be discussing today. But before I get started, I want to know your specialty. So I have placed a poll. Select your option. That way I get to know you better. Here I see that we have periodontists, general dentists. Let's see. Oh, we got a couple of prosthodontists. Wonderful. So it seems that 50% of you guys are general dentists, 13% of you guys are prosthodontists, and 38% of you guys are periodontists. So this is going to be great, honestly, for all of you. As for a general dentist, the software allows you to better educate yourself and also educate your patients towards the treatment. For the prosthodontist, it gives you the chance to select on different teeth shapes just by clicking a couple of buttons here on this SmileFy software. And for the periodontists, we have this new feature called cross-section, which allows you to visualize the patient's bone and soft tissues and also do the measurements of it, which gives you a better idea on where to place, how much teeth exposure you want to perform for your periodontal procedure. Great. So let me now go back here to the presentation. And today we are going to go over a special case, a case where the patient itself was not 100% sure on what type of procedure she would go for. Either just going for the composite restorations, which is what she came in for on the centrals and laterals, or going for a more complete type of treatment, which is what I found best for her, which is the option 2, as you can see over there, gingivectomy and veneers from second premolar to second premolar. What we find in dentistry today is this lack of communication between the patient and the dental technician and with other dental professionals. And one of the main reasons, it's because we tend to do it all analog. We tended to just write things down. We tended to just verbally express our thoughts to our colleagues and to our patients. And the problem there is that once you do that, you basically create a fragmented communication, which ends up giving a higher price on your workflow, an extensive turnaround time, and most likely you do not have any control over your wax-up designs. So what you're going to be learning today is how to have a better communication with everybody that is involved in the treatment, especially the patient. You will learn on how to create a digital wax-ups, which will give you faster turnaround time. You will learn how to involve your patient in the treatment. You will learn how to select from different 3D teeth design and how to integrate facial aesthetics into your functional restorations. So now, since I have a lot of amazing doctors like you guys here today, I want to know if you create your own dental wax-ups in your practice, or if you outsource your dental wax-ups, or if you don't do any of that. So I have placed a poll. Just please give me an answer. Okay. So as of now, we have here 50% of you guys outsource them to your dental lab. 25% of you guys create yourself digitally. I wonder if you guys are already smile designers from SmileFy. I'll ask you guys later, okay? But I see here that 11% of you guys create your own dental wax-ups, but in the analog way, and 11% want to start doing wax-up trials in your own practice. Okay, great. The reason why I'm asking, it's because I want to guide these webinar and I want to use this time that you are investing here today, so you can leave this webinar knowing how to create a workflow in your practice. By the way, the workflow that I'm going to show you today focus on the patient, okay? I know that many doctors have different ways of performing their own treatment plans, their own ways of creating the workflow for different types of procedures. But here, what I want to show you is how you can make the workflow simpler for your patient so they can better understand the value of the treatment plans that you provide. So we are going to go over the first appointment where we do our clinical exam, digital records, how we communicate with our patients through Smile simulations. Then we're going to go into this inter-appointment, which is where we create our 3D facially guided dental wax-ups. And then we're going to go finalize this webinar today with the second appointment, which is by performing the Smile trials. How long does it take to show the patient 2 types of digital wax-ups and how to make them get the best out of these treatment plans? So beginning with the first appointment, this webinar is based on this software called SmileFy, and SmileFy is available on App Store, and you can download it for free and try in one of our trial patients if you like to. But on the first appointment, along with all of your clinical exams and all of your complementary exams, we always start our treatment by taking a photograph of your patient. And the reason why, it's so you can, in quick steps, show your patient a possible outcome of the treatment. So in this case, for example, as I was speaking with my patient, I noticed that the patient wouldn't really smile to me or would try to hide her smile. And as she was getting more comfortable with me and with my team, she told us that she was very embarrassed with the gummy smile that she has on the back teeth. Knowing that, I was able to communicate with her with visual communication, showing her different options, showing her how she could how she could see herself with a type of treatment that that goes much farther than what she came in for. So I'm going to share my screen. And I'm going to use SmileFy iPhone version to show you how you can begin your treatment plan by creating a smile simulation. So on my phone, as you saw in the previous slide, you saw the patient standing up and in front of a ring light. So you place the patient in front of a ring light so you can have a better quality of that picture. Then you will take a picture of your patient and you will begin a smile simulation. In this case here, just for demonstration, I already have the patient's picture. So all you have to do is by placing the smile outline over the patient's existing teeth, actually, let me use another picture of her. Because the picture that you saw before, she wasn't really smiling, so I couldn't really see her full smile. No, there you go. So this is the right picture where the patients give me a big laugh and I am able to visualize the patient's real smile. So here, all I have to do is to place my smile outline over my patient's existing teeth. She came in because she thought that her laterals were too short, and in fact, they are. And after doing small adjustments towards it, you tap on Generate Smile, and a new smile will automatically appear. So as you can see, the smile simulation, the main goal here is to make the patient understand how a treatment plan that goes much further than just fixing those laterals would look like. Although it's just a simulation, meaning it only simulates the patient's smile with these smile frame over the patient's picture, it gives her a better understanding of why she needs to go through a gingivectomy here in order to have the smile that she feels comfortable with. So notice here that I have many types of adjustments that I can make. And simply by having this smile outline, I am able to show the patient without having to explain much the reason why she needs to go through a gingivectomy. The software allows you to change and adjust the color of your design as well. Which gives you the chance for you to also understand better the patient's wishes and desires. So in this case, for example, the patient was already telling me that she would like to have a wider shade in her teeth. Even though here we are not using the Vita shade, it gives me a better idea, a better understanding of what she is looking for. You tap on next. And here we have a before and after picture. This image can be shared with the patient, and it's already a great way for you to show your patient the possibilities of a new treatment plan. The patient was very happy with the simulation itself, but as I was mentioning before, this is just a simulation of the patient's treatment, so I cannot use it as a base for the entire treatment. For that, I need to create a 3D dental treatment plan. With the patient, with a simulation in mind, the patient agreed in taking the intraoral scan and agreed to come back on a second visit to perform a SMILE trial, now with the option that I proposed to her. So now let me go back here. So here it's just an example showing how you can present your SMILE simulations to your patient. You can share that before and after picture and place it on your television. And you can use the iPad or the iPhone to educate your patient on the SMILE draft that you did on SmileFy. So all in the same consultation, we also did an upper and lower intraoral scan of the patient's mouth. In that intraoral scanner, for example, we are using matted scanner. So if you have a matted scanner, you will be able to have a direct connection with SmileFy, which means that after you perform your intraoral scan, all you have to do is to log in with your credentials into SmileFy software and upload the files automatically. Same thing if you have a Trios from 3Shape. Those two intraoral scanners will allow you to do a direct connection, which means that after you scan your patient's mouth, you'll be able to upload them straight into SmileFy to begin your 3D plan. But what if I don't have a matted or a 3Shape? Let's say you have an iTero or any other type of intraoral scanner. Then in that case, you can simply upload these intraoral scanners into a Dropbox or Google Drive or iCloud and upload them into SmileFy. So the patient, she went home and she has the SMILE simulation, which we sent her via text message. And now let's begin our enter appointment, which is when we begin our 3D design. A lot of you guys have learned that the 2D SMILE design is the base for your treatment plan. However, a 2D SMILE design, which also brings with the red proportion, the golden proportion, has its own limitations. What are the limitations of a 2D SMILE design? The limitations are that a 2D SMILE frame, which is what you see in front of this intraoral scanner, it was created in a 2D format, which means that once you have these SMILE frame, instead of having the entire proportions of the patient's teeth, you will only see the proportions from a frontal view. When you have a SMILE frame that you see from a frontal view, and you place it over a patient's intraoral scan, which is a 3D format, just like our maxilla, you get the discrepancies on distances, especially on the proportions itself of laterals, canines, and premolars, as well as the width of the design that you are creating. Let me give you an example on the left side. If we place this SMILE frame in front of the intraoral scanner, you will see that you only see centrals, laterals, and mesial side of your canines, but you don't know your the distal of the canine, you don't know the proportions of those premolars, you don't know the proportions of those molars because you can't see the smile frame from that direction. Now, moving on the right side of your slide, you will see what we call a SmileFy 3D smile frame, which means that instead of having a smile frame that goes over the patient's smile from a frontal view, that smile frame will go around the patient's intraoral scans. So in that case, you will be able to set the proportions according to the patient's arch. And I will show you how you can deliver all that. In here, we are going to create two types of 3D wax-ups, and this is something that you can perform in your own practice. One is by creating composite veneer restorations, which is from what the patient came in for, because even though the patient liked the idea on a simulation, I still need to respect my patient's desires. So I decided to create two types of dental wax-ups using the same patient's files. And then the other one was the gingivectomy with the veneers. If you desire to create just composite restorations, all you need to have is a frontal picture of your patient and an intraoral scanner. If you decide to do a gingivectomy, for example, as I see it, we have a lot of periodontists here today, you also have the chance to add a bone file of your CT scan into SmileFy. Okay, and then if you have any questions on how to have the CT bone file, ask George, he's in the chat. We have a partnership with DiagnoCat, and he can give you more explanations on how you can also convert your DICOM file, your CT file, into a bone file and apply that into your cases using SmileFy software. So now I'm going to share my screen. Now, instead of using my iPhone version, which you guys already saw, I will use the iPad version, okay? The reason why I'm going to use the iPad version, it's because the screen is much larger, so it's easier for you guys to visualize what I'm doing here. So what do we have here? In order for us to begin our treatment plan in 3D, you will need your patient's photograph, which you already took from the simulation, the intraoral scan, which you can import directly from your Matted scanner or Trios straight into SmileFy, or upload it from an iCloud, Google Drive, or Dropbox. Then you will set 3 points onto the STL and 3 points onto the picture. Next, with your CT bone file in the SmileFy, you will do the same thing. You will set 3 points on the intraoral scan and 3 points on the bone file. Why are we using the intraoral scan and the bone file? Because if you want to do a perio analysis, you will use the intraoral scan as a base to see where the soft tissues are, and the bone file to see where the bone crest are located. Then here you will see a flash button called Set Points, and you will tap on Set Points, and the files will merge automatically. Then if you need to make any type of adjustment, you can use the buttons at the bottom to finalize the calibration. And this is a very rich information if you want to pass it on to your patient. onto other specialists that are working with you, because look at this, you can literally do your analysis, initial analysis, just by looking at the patient's digital files. Once you calibrate the patient's files, the next step will be to calibrate the 3D smile frame, which what we were discussing before, the frame that will go around the patient's arch. First, you do it from an occlusal view, which will define where the position of the design will be placed. Then you will preset the proportions of your future design using the SmileFrame 3D. They are represented by these lines that you see here at the bottom. For example, I have, I'm going to bring this more buckle, but here, just for you to see. Right here at the bottom, we have the smile curvature. On the top, we will have where the cervical margin of your future design will be located. And then these lines that you see like in vertical, the pink represents the interproximal contact. So if you see here from a frontal view, each line is kind of like crossing the patient's interproximal contact. And in green represents the dental midline. So here my frame was slightly canted. I just need to make here small adjustments. Then my next step will be to select the number of teeth that I want for my case. In order for me to do gingivectomy that I want, I will go from second premolar to second premolar. So I select second premolar to second premolar, hit set. And notice that the 3D teeth will automatically be positioned over the patient's teeth. You tap on next. And now all you have to do is to select the best teeth shape for your dental wax-up. Make the adjustments as you need. So here, for example, I'm going to increase those laterals as requested by the patient. Now, since you're visualizing everything in 3D, you don't only visualize your case from a frontal view, but you also visualize your case from different views. So notice that I'm doing everything all together, which saves me a lot of time. I see some doctors that you do it all analog. So instead of working only with one tooth, you can work with all of them together if you desire. So what is the benefit of you doing this type of treatment? It's because you have more control over the treatment. Also, it's fun. It's a lot of fun for you to do it because you will literally see the whole design coming out from something that you planned from scratch. Okay, so here I'm just making very small adjustments. I will integrate the facial reference in a second. So in this specific case, the patient already finished ortho. As you can see, the patient's teeth are completely aligned. So our next step here is to go for gingivectomy and then finalize it with the veneers. All right, so now here you can also simulate the design in the patient's mouth. Which gives you a better understanding on how much you would like to increase, for example, the length of that crown according to the patient's current smile. So once you define the aesthetics of the design itself, then we go ahead and move on to the perio analysis to understand whether we need to go with any type of osteotomy along with the gingivectomy, or if we can do a flapless technique depending on the position of the the proportions of the biological width and so forth. Here, for example, I'm changing these laterals as I don't like them. And this is something that you can do it at any time. Just changing, selecting different, and select a different canine as well. So then from here, you can simply tap on analysis now that you have finalized the aesthetics of your dental wax-up. And right here under analysis, you will be able to find the cross section on the right side. If you turn the cross section on, you will be able to check on measurements. To check on the height of the biological width, check on how many millimeters you will be removing from the patient's gingiva. Let me see. Somehow, like my computer, I have so much stuff in here. But let me see here if I can show you. Here. Here, for example, is another case. And this is also what I recommend you guys to do, to not do what I do here. Don't do a lot of screenshots. Make sure you have enough memory on your iPad. But here, for example, you tap on analysis, then you turn on the cross section, then you will see a button called measurement. With that button, you will be able to check on the thickness of your design, and also check on how much bone you will be removing in case of a osteotomy as well. So here in measurement, you're able to visualize the patient's existing bone crest, the height of the bone crest, and you can measure from the cervical area of your future design to the patient's existing bone crest height. Here, for example, in this premolar, I have about 1 millimeter. So for sure, I would need to increase another 1.5 to 2 millimeter in order to deliver proper biological width in those areas. Now, if I look here from the central, for example, notice that the patient's bone crest is much higher. So in this case, no need for osteotomy, any of these centrals and laterals. We come over here, take the measurement. And even with the gingivectomy, you will still have about 3.4 millimeter of biological width. Here in this case, we can check on the proportions of the patient's teeth design. It's in about like 10.78, which is great. And then when it comes to the gingivoplasty, here we have about 0.6. Incisal length, of about 1.2. Then we move forward. And in this stage, you tap on export model, which is right here at the bottom of your screen, and export these 3D walks up. Then, in order to create a non-gingivectomy case, you simply come over here, you make the small adjustments. For example, I'm going to just reposition the design following the patient's existing gingival margins. So notice here that I'm using the move button, which allows me to change the design without changing the texture of it. So I'm literally just making very small adjustments to it, following the patient's existing gingival margin. Removing all the excess. And now I have a second option without a gingivectomy. Notice that I did not change the incisal edge. I didn't do anything like that because I did it already in the previous stage for that case where the gingivectomy was needed. All I had to do was to remove the area where I was supposed to do the gingivectomy. You tap on export model. And once you export, you will be able to send it all to your 3D printer. Now, if you do have a Formlabs or NextDent or SprintRay, SmileFy has a direct connection with those intraoral scanners and a couple more. You can ask George to give you more insights about these direct connections that we have with these 3D printers, which means that once you hit export, it will go straight into your 3D printer software for you to close the mesh, get the grids, and 3D print them. So once you 3D print them, you will be receiving two types of dental wax-ups where you can create your silicone keys and then call your patient for the second visit. So in this inter-appointment, as you saw, I was able to calibrate all files, did a complex case, which involves a periodontal and cosmetic all involved, and create a second option just with the aesthetic portions of it, all within these webinar. And that's usually how much time you guys would spend in cases like that when you have to create more advanced cases like this. I would say about like 25 minutes to do two of these mock-ups, which allows you to take more control of your treatment and also take the freedom to design and change and try on different smiles to better collaborate with the dental technician if you are going to work with them still, or work better on your cases, doing everything in your office if you also have a 3D printer and a milling machine for later. Once you call your patient for the second appointment, since you already have two models that are 3D printed, you don't have to spend a lot of time in that second appointment. No more than 30 minutes is enough for you to perform your 3D wax-up trial. So here, for example, what you see, it's a printed model that I designed from SmileFy, which is from the patient that you were seeing here. Notice that the natural morphology of it was already transferred onto the model and transferred onto the silicone key. So with a bisacryl, in that case, I used a Luxatemp bleached shade because my patient wanted a more wider teeth. So I wanted to give her the best option as possible. So you place the dental wax up. I'm not going to go over here details on how to do it, but make sure to cut the silicone key following the patient's gingival margin, the cervical margin of your design. That way, once you remove it, it will look much nicer and will be much simpler for you to show it to the patient and make the workflow much faster. When you are removing these silicone key, make sure to first apply some force outward. That way you don't break the bisacryl, and then pull everything down. So this is an option with a gingivectomy. Notice the naturality of the 3D wax-up that was created. In this case, let's pretend that it was created by you, the dentist, following the facially generated treatment, and then selecting natural teeth shape. Look at the line of angles and all the morphology that is already in that dental wax-up, already available for you to use. Then, of course, check on the palatal area, check if there is any excess. If there is any excess, remove it with any type of instrument, an explorer or anything. Then use a soft flex if needed to check on occlusion, to check on guidances. That's just a little explanation showing you how I did the silicone key. As you can see in orange, I have the light body and then I have the heavy body as well. The reason why it's because I wanted to copy as much as possible the morphology of the tooth so the patient could have the best experience. And this is something that you as a dentist don't have to do it. You can ask your dental assistant to create that. Then take some pictures, take some videos for the patient to test it and have the full experience on what type of work that they would like to receive. Now moving forward, let's go now with the second option, which is the option where a non-gingivectomy would be involved in the treatment option. So all you have to do is to remove the bisacryl. Notice that I didn't apply any type of acid or etch or anything, or any bonding adhesive agent. I just dried the patient's teeth as much as I could and applied the bisacryl onto it. Then, as you can see, to remove it, it comes out very easily. All you have to do is to pop out that mock-up. Then on the second trial, the patient was able to check on both smiles. As I said it again, everything took me about like 30 minutes. So from that very first moment, when the patient came in on that first consultation, the first consultation took about an hour because we also had to take the pictures. We had to do some pair analysis. We had to do the simulation and then scan the patient. Then the in-between appointments where you do the 3D design, uploading the files into SmileFy, calibrating and performing the 3D design took about another 25 minutes to 30 minutes. Exporting and 3D printing, then it will depend on your machine. Here we used NextDent, so it took us about 30 minutes to print both models. Then to light cure it and finalize it and create the silicone key, another 40 minutes. So in total, from these 3D design part, it took us about an hour and 30 minutes to go from calibrating the files up until having the silicone keys. Then a second appointment took about 30 minutes, which the patient was able to visualize both options. What is the main message here is to show you that if you spend a couple of minutes creating your own dental wax-ups, treatment planning yourself, you will be able to sell much complete cases to your patients without having to force the patients to do anything. Here, you will be able to create a whole new workflow for a patient where you involve the patient from that first consultation up until the beginning of the procedure, giving them the chance to get involved and knowing from the beginning how their final restorations will look like. This is the type of workflow that we have here on SmileFy, which is to help you simulate smiles, which is a very quick, fast solution using AI technology to then 3D design your cases by uploading the patient's files, calibrating them, select the best teeth design, 3D print, and perform the mock-up trials. In this case, the patient selected the version with the gingivectomy and the veneers, and the final results was that the patient now can smile with more security, and she is now referring a lot of new patients because she was able to receive the best experience. We always say that patients are visuals. So by saying that, we mean that if you can show to your patient the work that you can provide, the patient most likely will do the job that you are proposing to them. So as you could see here, the 3D design involving all these files requires a little training. So we have in the United States a couple of courses that are coming up. One of them is the Smile Designer certification course, which is going to happen in LA in June 24th and 25th. It's almost sold out. And it's for those doctors that want to change their mindset and go for becoming a smile designer in your own practices, to get more cases, to be able to treat and plan their own cases. We also have the same course happening in 2 days on a Friday and Saturday. It's a 1.5 day course in Miami, July 22nd and 23rd. We will go over picture taking, to smile simulation, to scanning, to performing on 3D walks-ups, 3D printing, and perform the mock-up trials for different types of procedures. We also focus on composite restorations, which is something that you can do it from your SmileFy straight to your patient's mouth without the need of using a lab. So we have an online program starting on June 9th. And as a thank you, we want to give you a $300 discount for all of the participants here today. If you are interested, George will be here in the next couple 5 to 10 minutes to give you all the insights about our courses. If you are in the United States and would like to travel to the United States, we also have our in-person direct anterior composite restoration. The next one, it's in about 3 weeks, but it's sold out already. And we have our next in-person course, July 29th and 30th, where we will teach you the entire 3D workflow for composite restorations. And on the second day, we will teach you the technique on how you can use preheated composite restorations, which is a modification from the injectable composite restorations you guys already know. These courses are also limited to 15 seats only, and the second course is almost sold out as well. So if you have interest on performing your own dental wax-ups, getting the freedom from using and having the need to have your dental technician for all cases, then these are the best courses for you guys. Now, my very last question is, do you find SmileFy 3D wax-ups useful for your practice? So I have a poll here, and I would like to know from you guys now that you have already seen the entire workflow. All right, wonderful. So here, as I thought, we have here 25% of you guys, and we got almost 100, over 100 registrations for this course. Almost 25% of you guys are already member. So now it makes sense that a lot of you guys perform your own dental wax-ups digitally. I have 25% saying that you want more information. 50% of you guys are still learning. And what I tell you guys to do, for those who are already members, it's always a pleasure to have you guys here. And, you know, we are a family here at SmileFy. We have doctors from literally all over the world. For those who want more information, Dr. George will be able to help you out finding out the best solution for your practice. For those who are still learning, this is how you get started. You come to our webinars, you go into our websites. We have a lot of on-demand masterclasses, on-demand webinars for different types of procedures, different types of workflows. And I highly recommend you to go into App Store and download SmileFy so you can request a 14-day free trial. So whether becoming a member today and taking advantage of our promotion or downloading the software to try it out, you are always welcome to come to our webinar, always welcomed to learn more about SmileFy. So Dr. George is here, and I believe we have a 50% discount, George, for the upcoming, for the new upcoming members. Yeah, so for the new members, talk to George and he will be able to give you a 50% discount on your membership. Okay, we have a couple updates coming up in a couple of weeks, which also will allow you to create your own implant design and your crown temps and so forth. So that's the reason why the price will increase. But if you are going to become a member, you will be able to get a 50% discount on your first year of membership. So that's it for today, guys. I want to thank you very much for staying here with us. It's always a pleasure to show you all the benefits of using the software that has changed a lot of doctors' mindset and has helped a lot of doctors grow their practices. Dr. Diogo Alves, Dr. George will be here in the chat for the next couple of minutes. If you have any questions, now is your chance to also become a Smile designer. Thank you guys very much.